Hi everybody. So every time that we end up in the hospital, I have the best of intentions thinking, you know what, I'll update everybody after and I'll send them messages and I'll put a post and I'll do a blog and I'll be able to put everything out there. And then life gets crazy and I never get it done, and maybe it's the ADHD or the fact that my plate's just a wee bit loaded, but never seems to happen. So today I'm at beautiful Michaela room at McMaster, and I thought I would just do a quick video to give an update of what's going on. We have been having some little issues with William's one ear tube. He's had ear tubes pretty much his whole life at this point. He's now on his third pair. We were having some problems with the second one. It was clogged, and so the ENT, amazing, Dr. Corman, had gone during one of her ENT appointments and I held him down and he tried to dig into the tube to get the clog out. Got a little bit of it, but not much. Said it might work itself out, especially, using drops and stuff. Then, because we had lost William's hearing aids, we had to go get new hearing aids. And when we were in there, our amazing audiologist, Ashley Lamb, at Shaver, she, and I do say amazing because there's nobody quite as patient and as incredible with him as she has. Been so flexible because it's hard to do hearing tests with him. And she did notice that the tube was completely blocked again. And we did the drops again. Double checked when the hearing aids came in, and it was still completely blocked. So we booked ENT right after our complex care last Wednesday to have a look. And so today's now Wednesday, the 19th of February, 2025. Yeah, I think it's the light year. And I keep saying and instead of I don't know if that's an improvement, but we'll see. The ENT appointment was a success in the fact that he was able to pull out the ear tube, and knew that we wanted to get them replaced because he's had a significant amount of fluid behind his eardrums. So we booked for the soonest appointment we could get with Dr. Reed. Amazing doctor. I'm so impressed with her. Her bedside manner is incredible and she's so good. It was a bit of a interesting adventure doing the pre-op because we were able to do a lot of it by phone. The pharmacy and the nurse, they just said the anesthesiologist had to see him in person. So we came to Hamilton, we waited 2 hours, to the point where we had a little bit of a hiccup and had to have somebody run to the urgent care there to get us some supplies. Finally got to see the anesthetist, who was also a great guy, and said, I don't know why you're here. I know he looks complex and he looks scary on paper, but he's had lots of times that he's been anesthetized because he used to go every 4 months for Botox. Never had a problem as long as we don't touch the fentanyl. So 2 minutes later, after a 2-minute appointment, we're gone. We came in yesterday. On the way in, we got a call that there was a cancellation, so they were going to get him in for his surgery early, and sounded great. We got suited up right away because we got here at 9 a.m. He hadn't had food since 4 a.m. Came in, got suited up pretty much right away as they were doing the intake. Actually, I'm putting on the surgical outfit to go in with him and getting him into a gown. We get in there, no problem. They have learned very quickly, and they're amazing here, that they know that as soon as he starts to wake up and come out of it, it's best to come and get me. Because I don't know if it's because he's deafblind, if there's been so many occasions that this has happened or what, but if he wakes up and I'm not around, he starts to panic, he starts to grab tubes, he starts to go high tone, he starts to just freak out. So as soon as he starts to stir, they come and get me. Now, we've had leakage before from the tubes, especially the very first pair. There's quite a significant amount of leakage, but nothing like I saw yesterday. So when I went in, there was lots of blood, and they were having trouble getting the ear to stop bleeding. So got him comfy. He relaxed as soon as he saw me. He got in my arms. I got in the bed with him. We were able to see that got him onto his stomach because his throat was he was bugging him because he likes to be on his belly and he likes to be on me. And that's when they were able to they were trying really hard to get a clear picture. Dr. Reed and her resident kept coming back after each of their procedures and suctioning. Actually took one of the regular suction catheters to suction out the ear. That was lovely. There was quite a bit that came out, and got the first clot. And I'm talking a blood clot about, like, it looked like a very full tick. Like if anybody's ever seen a really full tick that you take off, that's exactly kind of the size of the clot coming out of his ear. Long and short, we got about 6 clots out of his ear in the process of a couple hours, and it still wasn't really stopping. The blood clots also seemed to have pushed or dislodged the tube that was in there. So it came out. We decided, since he was such an incredible kid, partly because he doesn't show pain, partly because he's just one tough ASS kid, to give it a shot and try and get it put back in at bedside. But when she went to go do it again, even though he was on another round of morphine, he was flinching, and just Dr. Reed made the call and said, you know what, it'd be much safer to go in, and then I can really rinse, find out what's going on, and get it taken care of and get a tube reinserted. So I don't know if this would count as his 4th tube now, but whatever. I know, I'm just being a dork. He had to get another OR room booked and get another anesthetist, because the first one had gone home at this point. So they got a new one. She was lovely as well. I took him in, got suited up, took him in, got it laid down on the bed until he's out, and then I leave the room, and then went to the recovery room. Now, poor Daisy and Keith had been sitting in the waiting room this whole time, as much as I could update them by the phone. But, you know, sitting there waiting. And so we had a few moments together, got a bite to eat, because it was supposed to only be a 15-minute procedure, but they gave it a lot longer. Because she actually went in and she cleaned everything out and discovered it was a bit of a nick on kind of the side of the canal. And it's possibly because we'd been having problems with that gunk that was kind of getting stuck on the tube, like old wax or clots, or like it could have even been a scab, or even from the scar, because he's had tubes a couple times now. Anyways, it got nicked open, I think, or got nicked, and that's what kept bleeding. So after it came out, he was doing great. He very quickly bounced back, definitely feeling himself, definitely wanted to go home, ready to get the heck out of Dodge. The one thing that I kind of had nervous feelings about this whole time was that he hadn't had anything really to eat or drink since 4 a.m. He'd had his meds, but he wasn't getting his usual doses of fluids. I kept pushing as much as I could to get fluids. He'd had an IV when he first came out the first time, but because he'd gotten agitated and we didn't foresee having to go back in, we'd taken it out to make him more comfortable. So then we had to get the port accessed. He has a power port. That's a whole nother video talking about having that. That could be a couple videos. And so we did get the IV nurse to come down, God bless her, and she was able to get the port access right away. So we were able to get some more meds into him, get him into the OR, and then he bounced back. Had to call the IV nurse again to get it de-accessed, and then we got home. Seemed to be okay for the first hour or so that we were home, and then started to get really sweaty, diaphoretic, agitated, but we thought, you know what, the pain meds have worn off, like the morphine's gone, and you know what, it was not fun going in and getting your ears done a couple times, no matter what, that's not fun. So we gave him some meds, got him settled down, noticed that he was getting slightly tachycardic, his heart rate was starting to go up. He doesn't indicate pain very much, or very well, I suppose, or in an easy to comprehend manner, let's put it that way. So we have to try and put the pieces together as much as we can. He did have some rest. Keith and I were able to get a little bit of rest when the night nurse came in. I thank God for Keith. I fell asleep before then because I hadn't slept the night before. I was really anxious about this surgery for some reason. Guess now I know why. And so when the nurse got us up at 2:33 this morning, because his heart rate had gone from, normally when he's asleep, it's like under 100. When he's awake, we'll be in the low hundreds to maybe maybe 130 if he's really, really active. And his heart rate had gone up to the 180s. And he was pale as anything. He was really, really cold. And they call it like a cap refill. So when you press and it turns white and you're waiting for the color to come back, it had gotten over 3 seconds. So calls to the hospital, thank God for Koala. They answered the phone 24/7 and they were able to pave the way for us coming to Mac. Got here, didn't even really do triage. He was already alarming off and everything, so we got him to the resuscitation room. And 15 people working on him at once, and God bless him, they allowed me to stay right at his bedside, holding his hand the whole time to try and keep him calm. They were able to access the port. They tried to get another IV in. They've made at least 6 to 8 attempts to get another IV in. That wasn't happening. They were able to get 2 boluses, or 2 500 mils bolus of fluids, and then another 250 into him. And now we've got him transferred up to the ICU. His lungs are great. That happens when he's dehydrated. He's not aspirating anything, so the lungs had a chance to heal. So his lungs are great, but right now he is laying in the bed. He is completely lethargic. His heart rate's in the 160s, and that laying down, not doing anything is not normal. Plus, it also tells you something, the fact that he has a vent on and is not fighting it, hates the vent, so normally pulling it off. And then the other thing is they're trying to get a urinary catheter put in right now, and there's 2 of them have attempted, and they are continually attempting. They've done it at least 4 times now, trying to get it in, and he's not even flinching. So I decided to create a video. Long story short, if you've been here this long, extra prayers. Our boy certainly keeps it interesting. There's some thoughts that maybe we either have an infection in the gut, because we've got some free fluid down there, or we might have an infection in his port line. Yeah. I'm worn and I'm scared. And my boy is so incredible. And one of the hardest things I had to do is when I came in here, said, in all the tests that you're doing, I also need you to x-ray his hips, because I had to hold him down so long and so hard when he was fighting against the ear stuff. I wasn't sure if I had hurt him. So came back perfectly fine. That's all good. I'm now getting a message am needed again. So that's my update. I'll try and update you as soon as I can. Love you all. Hope everyone's okay. Stay safe. Extra prayers. Bye.